Hi, welcome once again. This is Mr. Reyes. As we continue our conversation on chapter 8, we covered steps 1 and 2 about the venipuncture process. So hopefully you've seen that video before you watch this one so you can be familiar with how important it is to properly identify the patient before you begin the procedure. Remember, there are at least two minimum identifiers that need to be performed or stated by the patient, followed by approaching the patient. Establishing a good rapport or trust with the patient begins with your physical presentation. So as we continue our conversation on the venipuncture process, every single step has a meaning. So we're going to discuss something that is also equally important, and it's about safety. Your job as a phlebotomist is to ensure the safety of the patient at all times throughout the whole procedure. So therefore, once you've established and obtained consent from the patient, you must make sure that you verify any allergies or any type of restrictions. For example, you first want to ask if the patient has been informed or has followed through with the dietary restrictions. Most or several specimens that you need to collect require fasting status. So therefore, the patients should have been told to be fasting before midnight or after their last meal of the day. Therefore, after you've done steps 1 and 2, you must ask the patient, have you been fasting? Or rather, you should ask, when was the last time you had a meal? I think it is a better question because if you ask, have you been fasting? A simple yes or no will suffice. The patient may be afraid to redo the whole process again and may not be truthful to you. So therefore, if you ask them, when was the last time you had a meal? And they say, well, last night at 9 p.m. That would, I think, gain a better response, a more honest response versus a yes or no. Therefore, if it's been at least 8 to 12 hours of fasting without eating food, then the patient is ready for collection of the specimen. So you need at least 8 to 12 hours. This is considered fasting, right? Now, they should be able to drink water. You do not want to have the patient avoid drinking water because this could also adversely affect the results as the patient may become dehydrated. So it is very important that you ensure that the patient continues to drink water. Sometimes patients will misunderstand and they'll think that they should not drink water or eat at all. On the contrary, we want them to stay hydrated, okay? Just normally hydrated, not too much and not too little. So again, please verify fasting status of the patients. Now, you must also ask for any type of allergies. For example, we're always asking about latex. Latex is a product that is used to make equipment such as gloves, tourniquets, and other products. So if a patient has a latex allergy, they might react, right, when they come in contact with the product. So you want to avoid that by simply asking. However, there are other products that we use that people may have allergies to, such as iodine. So you don't want to just limit your questions to latex, but maybe iodine is another product, or alcohol. I know very few people are allergic to alcohol, but it's always better to ask. So it could be any product, any food items, all right? So please make sure and you get a good, thorough response as far as allergies are concerned. It is a safety measure that you are responsible for. If you forget to ask and the patient has an allergic reaction, it will be considered an incident and thus bad outcome. So again, simple questions can take you a long ways and prevent a lot of problems, all right? So that was step number 3, verify diet restrictions, all right? And latex allergies, very, very important. Now we're gonna continue with step number 4, which is about antisepsis. Remember, we have to work with infection-free processes. So anti against sepsis is infection. So how do we practice antisepsis? Everyone knows that we have to use gloves. It is OSHA regulations that we use gloves when we are going to perform a venipuncture. However, there are a few exceptions where policies of the facilities allow you to palpate veins without gloves. So if there's no policy about you palpating without gloves, then you can proceed. However, when you are getting ready to venipuncture, you must use gloves. That is OSHA regulation, all right? So sanitize your hands. Wash your hands for at least 20 seconds, okay? And then dry your hands and continue. Doing this in the presence of the patient sometimes reassures them that you are practicing good hand hygiene and that you are a safe